Hi, everyone. My name is Blake Cadwell. I am a hearing aid wearer, and I'm also the co-founder at Soundly.com. And today I'm joined by Dr. Amy Sarow, and we're going to be talking about how hearing aids work. We're going to go inside a hearing aid and really understand how sound goes from the outside world and into your ear, and the process that happens in between. And the way that we're going to do this is we're going to take some of the most common components that are inside of a hearing aid, from the microphones to the processor to the amplifier, and then the receiver or the speaker. We're going to break these down, and Dr. Amy is going to help us understand what's actually happening at each of those stages. So, Dr. Amy, maybe you can start with the outside, the microphones that are on hearing aids, sort of regardless of shape and size. All hearing aids have microphones. What are those microphones actually doing?
Yeah, so most hearing aids have two microphones, and they're going to be scanning your environment, and they're going to pick up all the information that's coming in. And then they'll be processing that later, which we'll get to. But what's really amazing is nowadays what hearing aids are able to do. They're able to pick up sound from your environment, and they're scanning your environment hundreds of times every second. So really amazing if you think about what's happened over the last decades with hearing aids.
So these microphones are kind of sweeping the room, almost like I imagine like a beam or a spotlight, trying to figure out what is the sound I should be paying attention to, and kind of gathering all of that data. Then once your microphones have that data, they're sending it to the processor, which is sort of the onboard computer. Can you tell us what happens at that phase in the hearing aid process?
Yeah, so it's going to be a little bit different depending on which manufacturer you have. Every hearing aid has a different philosophy in terms of what they do with sound, but the hearing aid is doing a lot of complicated decisions. You can think of it kind of like the brains in the operation. So there's a little computer in there. It's collecting all that information from your surroundings, and it's deciding very quickly, within less than a second, this is background noise, or this is speech, or we're in an auditorium, we're in a quiet room, so I'm going to change, what I'm doing with your environment to help you hear your best. So it's making those decisions very quickly based on the information that the microphones are picking up.
Yeah, and the computer in most hearing aids is also, the processor is going to be making decisions also based on the hearing loss that you have and the way that it's been programmed by an audiologist. So it's responding to the environment, and it's customizing based on your individual hearing loss. So once the computer's done with its work, it sends the signal on to the amplifier. You want to talk to us a little bit about the amplifier, and then kind of the final destination, which is the receiver or the speaker that's inside the ear.
Definitely. So you can think about this whole process. If we want to sort of pare everything down to a simple analogy, think about it like a filter. So, if you have coffee, you take the grounds and the water, it's passing through the filter, and you're getting, the end product that you want. It's the same kind of thing with the sound. You're sending the sound in, or it's picking it up from the environment, and then you're going to apply some changes to it, like you mentioned, based on the hearing loss, based on the environment. And it's the amplifier that's then doing what the processor or the brains is saying to do, and then eventually it's going to end up in the speaker, sent into your ear canal, and then that's the final product to help you be able to hear in those situations.
Yeah, and I'll say from personal experience, the way that this feels, if you haven't worn hearing aids, I think situation where I really notice all of this at work is when I'm at home, maybe in my kitchen with my wife. My microphones are sort of sweeping the room, trying to figure out what's the kitchen sink, what's the sound of the stove fan, and what's the sound of the voice of my wife's voice. Trying to focus on that information, pulling that in, putting it through a filter that matches my hearing loss, which is a cookie bite. So amplifying those mid frequencies, since my hearing loss slopes in the middle, and then sending it into the speaker, which is inside of my ears. And it's doing all of this within milliseconds. So I'm not even noticing a delay. And that's really kind of the magic of hearing aids when they work properly, is they're taking sounds, converting it, filtering it, as Dr. Amy said, and giving you something that helps you understand speech and the world around you in a different way. So that's how hearing aids work in a nutshell. Thank you for watching this video. If you want more information about hearing aids, you can go to soundly.com.